Welcome to Citrine Presents. My name is Yesenia and I'm one of the community resource navigators at Citrine Health. Our mission is to connect women and their families to services and resources for health and wellness. I wanted to introduce our next guest. Our guest is Jessica Burt. She is the Interim Director for Community Health. Welcome, Jessica. How are you today?
Good. Thank you. How are you?
Good. I am so happy that you're able to come and spend time with us and be able to share your knowledge with us.
Of course, yes.
Tell us a little bit about yourself and where do you work and what do you do?
I'm Jessica Burt and I work here at the Providence Institute for Healthier Communities. And I have joined the team here in 2015 as a community health education manager. And it was a small group. It remains a small group, but there was just a team of 2 or 3 at the time. And really just from the ground up, kind of starting from the mist, started to kind of think about and create and build some of the programming that we still have today, actually. And then just in the past 6 months or so, became the director for the Institute as our founder, Scott Forslund, retired.
I did want to introduce everybody to what you call a PIHC, which is the Providence Institute for Healthier Community. I know in your website it says PIHC everywhere, so wanted to make sure that when we do talk about it, people know what we're referring to. Would you let us know what the mission for PIHC is?
Yeah, absolutely. Because, we're in this complicated world of healthcare. I just wanted to kind of preface our mission by saying that we do sit in the Providence, Swedish, North Puget Sound region, and we're in the Everett area, the Everett office. So since we kind of sit within healthcare, it's just important to know that the Institute for Healthier Communities is really looking at expanding the conversation outside of healthcare, and that health is more than healthcare. And most of our health happens in community. Only 20% of our health happens like in a clinical setting. And so I think that's just a really important piece that I want to preface our mission with, because that includes kind of supporting internal conversations within the hospital or the healthcare system, in addition to kind of being an advocate in community. And certainly not to take anything away from healthcare. We all have probably had to have hard time where we needed good quality healthcare. But our purpose is really to kind of bridge the gap between clinical and community connections and resources. And that's really building those trusted relationships with community so that community can access care locally when needed. But also, just as important as healthcare is also to connect with community resources that are outside of healthcare, because we know that that's where health is happening. It's happening, in communities. So our purpose is really to kind of make it easier for all communities to be healthier, and doing that by kind of being that bridge and connecting people with resources. And one of the things too is that it's a lot less costly, right, in community. And so it's kind of supporting some of those efforts to bring down healthcare costs as well. And we think about health in 6 dimensions of health. So, and it's kind of how our community defined health and well-being when we first started the Institute and asked our community, what does health mean to you? Which is kind of neighborhood and natural environment, and is physical health and mental health and security and basic needs, and relationships and social connections, and mental, emotional, spiritual care. And when we did this study with folks, or this focus groups, really only 2 attributes or indicators around health were focused on clinical care or healthcare. So out of 42, everything was outside of clinical care. So it's certainly how our community thinks about health as well.
I love that here in PIHC, you guys connect the dot from what is standard of healthcare to what is actually needed in the community. Going anything from educating your partners to be able to have tools for the community. I think that's fantastic. Can you also share with us when the Providence Institute for Healthier Community was formed and just a short little history of it?
Yeah, absolutely. And I had to do a little digging on this too, just to jog my memory. But I just kind of going back, even maybe before we started as an institute, I'll just mention that in 2010, the Affordable Care Act was enacted. And one of the directives in that was for nonprofit hospitals to kind of have a greater role in kind of community engagement and population health. And Providence had been doing quite a bit. And in the 5 years following that, had taken on some community leadership roles. There was a Snohomish County Health Leadership Coalition forming, but still wanted to do something on their own and have their own efforts engaging with community and building those trusted relationships and kind of, like I said, kind of having a bigger picture of health and healthcare. And so that's in 2015 when Providence Institute for Healthier Communities was launched. And really an important part of the history for PIHC. And then since then, there was just a lot of firsts, as we were busy kind of building our initiatives and kind of throwing spaghetti at the wall on what sticks and what's kind of good for the community. Then COVID came, and so a lot of our work was redirected into kind of a COVID response. In that time as well, we do a lot for community, any self-defined community. And so there was an effort to also think of Providence employees or caregivers as community. So like I mentioned, there was this effort to do a DEI and caregiver equity and well-being initiative using some of the tools and resources that Providence Institute for Healthier Communities had done for community. So that was part of our history. And then also a lot of the COVID response rates and working with BIPOC communities to get vaccine equity and vaccine distribution to communities who needed it most, whether it was PPE or vaccine. And now we're kind of reconfiguring and resettling from that work. And we just kind of did an updated strategic plan. So that's kind of where we are.
Yeah, building a relationship and getting out there and kind of allowing people to know who you are and what you're doing and them trusting you and being able to letting you know what they need is fantastic work to be able to do. Where can the community find you?
Our programs are really a lot for organizations to work with communities because communities and organizations know the people they serve best. And so a lot of our tools and resources can be tailored and meant to meet those community needs. A couple of tools in particular that I was going to highlight for you guys today is the Health and Wellbeing Monitor. So that's an opportunity for the county to say, what is the state of health and well-being? And we've done that annually since 2016. And so that's a county-wide survey. That information is posted on our website. So folks can go in there and find out what that information means, maybe kind of check it with their communities, see what resonates with their community. We use that for our community health needs assessment here within the hospital as well. So that helps kind of define and guide our work in addition. So that survey, it is kind of focused on what drives health and well-being. So it's a little different than kind of what's going wrong or what kind of is the clinical markers of health behavior, but it's how people perceive their health and well-being, how satisfied they are, what their beliefs are. So so it is a little bit different in the way that it talks about what's important to folks. And then that can be used for community. So that same survey can be tailored and used for any self-defined community. So so we have, several folks that are doing that in the community. So anywhere from like Everett Housing Authority, we've done it for our own internal caregivers, improving school attendance is using it for their collaborative, working with housing families who are housing challenged and getting those kiddos into school, even though they have unstable housing situations. So there's a variety of ways that communities have used that tool and can connect with us on that. We also do have an individual opportunity. So on their website, folks can go in and really kind of self-guide themselves through what's important to them, how to connect with resources in the community. And we'll have an individual survey coming pretty soon on that as well. The other tool that's great for folks to use is something called livewelllocal.org. And so that is a community resource hub. And we've got about 2,400 local listings on there. And so people can go there directly and find what they need kind of based on those dimensions in our community. Organizations can go in and add and update their listings and kind of control their own listings, how they want them to look and feel, and kind of be part of that. That can be customized for communities as well. So what we found is that, there's a lot of resources out there, but sometimes they're hard to find, and there might be, they don't have a lot of visibility. And so this helps support those communities to be able to do that in one kind of place, and also kind of to crowdsource it and help be that community chest of resources. But we also know that some communities don't need 2,400 resources for their small communities and kind of their focus and their target area. Maybe they just want something for a geographic area, like Stanley Camano has their own, and they just want listings that focus on basic needs for their community. Or we've got one for Equity Partnership that started with vaccine equity, and where can folks find vaccines within that. So that's an opportunity for folks, communities, to actually kind of customize that and make that their own, and with their own resources and their own needs that are important to them. So, so those are just a few kind of tools that we have in the community, and different ways that folks can use them. Otherwise, we are located here in Everett at 916 Pacific. We are mostly virtual, as I know a lot of people are, and most of our work actually happens in community anyway. So we do have a small team. Myself, Jessica Stallings, she is the community health education manager now, and Ann Alkema, who is a program project manager and helps really run our Edge of Amazing and get that up and running and managed every year. And then Patty Nichols, who's helps with our operations and a lot of those behind the scene things that I'm sure you all know about. So beyond that, we are out in community doing health education and outreach. So a lot of the events that happen, and I know that's where I see you, and that are happening in community. So whether it's a resource fair or other kind of event that you can find us out there. We also kind of help be bridges internally. So there's internal service lines that also kind of go out in the community. So we help kind of create those connections. So there is other Providence service lines that come out, like Stroke Outreach, or Providence Hospice and Home Care, or Providence Intervention Center for Assault and Abuse and Injury Prevention and things like that. So we help kind of manage or coordinate, so to speak, those folks, and also what community events are out in community. So that's one place. Of course, the Edge of Amazing Conference happens every year in the fall, and it's a place that organizations kind of come together to network and collaborate and celebrate too the work that's been going on in community.
I think that's great that people can come to local community events and be able to connect and ask in-person questions, and then also find direct resources on the computer. Definitely.
Yeah. Because, like we said in the beginning, we know that that's where health is happening. It's happening in community. And I think reaching people where they, where they are and where they're out, live, work, and play outside of the hospital building is really a big part of what we do and what kind of our mission and our connections are.
I see that PIHC really tries to involve all communities. Why was this important for Providence to do?
That's a great question. Yeah, we do serve all of Snohomish County, just within, our service area and really beyond, but this is really a local effort. And it's important to us because I think it's really, based in our values and mission, which is that we are interconnected, right? And really a single organization can't address everything. A person needs to be healthy, and And so it really does, take a village, that old adage. But also, there are barriers, to health and well-being, for sure in our county, and especially among, those who may be low income, are marginalized in other ways, BIPOC communities, or, there's just health equity and disparity issues. So one of the things that's important to us is really to advocate for more, equitable access, to resources, to care, and for all communities to find resources that they need, because we're really only as healthy, right, as our as the least healthy of us. And so it's important that all of us kind of come together. And one of our vision is really healthier people, healthier relationships, healthier communities created together. And we feel like that's the only way that people can truly be healthy. That is, the power is in community.
I like that you thought about anybody from any kind of economical stands to the BIPOC community, which is the Black, Indigenous, and people of color, being able to connect everybody so everybody can have an equal advantage to healthcare and whatever resource they need. I think that's great.
Yeah, I mean, it's a work in progress for sure, but yeah, I think with our mission, it's aligned with a lot of other community programs out there. And so, yeah, such important to get that access out there. Yeah.
Yeah. And then being able to see what wonderful program you guys have here. How can people find a similar program in their communities if they're not in Snohomish County?
This is an interesting question, because we are, a little bit unique in that way. The message I think I want to kind of leave folks with is really to decide what's important, for each person and each community, decide what's important for their own health and well-being, and kind of ask that question for themselves. Because getting curious first about your own needs and your own community's needs is really going to guide you to where you want to find those programs in community ultimately, right? If it's in Snohomish County, you could certainly look for livewelllocal.org and find those resources that connect. But outside of Snohomish County, there are other things like 211 or, other resource connections that are out there.
And you never know who might call you, be like, hey, we want to do the same thing in our community.
Yeah. And for us, it's like, yeah, we do have smaller subsets in Snohomish County, but yeah, outside of Snohomish County too, as well. Yeah. Don't tell my staff that might be
Yeah. Well, Jessica, thank you so much for spending the time with us. We have learned quite a few to be able to educate ourselves and be able to find resources and tools in the community to find beyond of what we think healthcare is. Thank you so much.
Yeah, absolutely. Thanks for having me.
Of course. Thank you. Thank you again to Jessica and the Providence Institute for Healthier Community for spending the time with us today. It's really nice to be able to know that there's an organization out there that wants to find a way to get to know the community and see what a healthier path is for them. Thank you so much for being able to share all the resources and the tools that the community can actually find and use to have a healthier path. Thank you again for watching this video. Please like and comment and subscribe if you haven't subscribed yet. Have a great day. Bye.